it was just striking to me that our patients with addiction had more biochemical abnormalities, more areas of chronic malnutrition, more genetic vulnerabilities than, let's say, my depressed patients. So,
if you don't mind, why do you think that is?
With this podcast, what we're trying to do is have real, authentic discourse.
Dr. Greenblatt, it's good to have you here today.
It's great to be with you. Thanks, David.
Been able to spend the last day with you, and it's been an absolute pleasure. We just launched this podcast. We just did our first one last week, and this is one of the episodes I've been really excited to do. It's kind of a passion project for us, the area of functional psychiatry. So I am very excited to have you here today. I think the audience is going to love listening to you. Maybe just by way of beginning, maybe just give a touch of your background just so people have a little context of kind of who you are and what you're doing.
Sure. I'm a traditionally trained psychiatrist, but I started medical school interested in nutrition, thought I was going to cure the world with brown rice and kale. That was 45 years ago. And ended up as a psychopharmacologist prescribing medications for children. I was a board-certified child psychiatrist. But very quickly in my practice, I realized medications weren't the answers. They were Band-Aids, and sometimes you need a Band-Aid, but some kids didn't get better. Some kids got worse. And I started delving into why I went into medical school, understanding the relationship between nutrition and brain function.
Okay, just give us a feel. Where did you go to school at? Where was your education?
I went to George Washington University in D.C. And then did specialized training in child psychiatry at Johns Hopkins.
Okay, you've been practicing. I don't want to have you reveal your age, but approximately how long?
Well, last time I counted, it almost hit 40 years.
Okay.
But 35 years out in the world seeing patients across every level of care, meaning hospital, outpatient, residential. So I've seen patients struggling with severe mental illness and those struggling as outpatients with depression and anxiety.
Okay. Well, I thought maybe we would kick it off, just give people a little bit of context how our worlds collided. We met last year, and as people know, with Inner Health, we're a addiction treatment company. It's been around for 17 years here in the Dallas-Fort Worth Metroplex, and have always prided ourselves on being progressive, evidence-based, trying to seek newer, credible ways to do treatment. And I'd say probably about 3 or 4 years ago, had a couple of different situations come across my orbit, if you will, that really raised my attention to this area. I called it functional medicine, but it eventually led into functional psychiatry. It was really post-COVID. We have an opportunity to meet with a lot of different physicians, concierge doctors here in the Metroplex, and we were having dinners, and it was just really interesting to me to get to know this level of physician that was doing so much more diagnostics on their patients than just your traditional PCP. And as I met with them, and they talked about COVID, how they were treating COVID, how they were treating their patients, the different biomarkers they were looking at, it really perked my interest to why isn't medicine really practiced more like this? And that sort of started a investigation on our behalf of meeting with different doctors. A lot of nomenclature around this. I know you and I talked about this yesterday. You've got integrative medicine, you got functional medicine, you got alternative medicine. But I was going down these little rabbit holes of learning what integrative medicine was, functional medicine. A lot of these concierge doctors were really practicing both. And I kind of netted it out in my own mind as this is really just good medicine. This is a way to really look holistically at a patient, to give them great feedback and help them have healthier, happier lives into the future. So as we started to go through that, looking at what we do in Inner Health, it made me wonder, why don't we do any of this in psychiatric treatment? Why don't we look at any of the biomarkers, do any sort of laboratory test, as it relates to patients that are coming through our treatment. And came across a couple of articles that you had done, some podcasts, and it became pretty clear that there's this area that has been around for a while. You've clarified my thinking on this. This is nothing new, but it's new, I think, to the field of addiction treatment and psychiatric care in terms of how it's traditionally treated, which is really this area of, say, call it precision psychiatry or functional psychiatry. You and I had a chance to jump on a phone call together, get to know each other a little bit better, and came to town, and I felt like we connected quite well because what we're trying to do is advance the areas of treatment as it relates to psychiatry. So much of what we do in residential addiction treatment is really on the therapy side, but very, very important aspects of it are related to psychiatry. And, the term dual diagnosis, dual disorder, how do you address that more effectively? And felt like we're at a pivotal point in treatment today where you're moving a little bit away from symptom management to really root cause of why you're having these symptoms and how you treat it.
Yeah, I think, I've been asking similar questions for 30 years. Why has it been so hard, particularly for the addiction and mental health world, to embrace looking a little deeper, looking at objective tests to help determine a treatment path? But I think things are changing, and mental health is far behind. I mean, in cardiology and other specialties, we can talk about words like prevention and lifestyle changes that might help. Psychiatrists are just beginning to touch the surface. Addiction medicine, just beginning to touch these points. But in my career and in the clinical work that I've done, it is really life-altering. The trajectory of either a young adult or child being put in this world of chronic addiction or chronic mental illness, I've seen completely be reversed by just broadening our assessment tools and our treatment model.
So this area that you've practiced in, it's been around for a while. And in your opinion, why isn't this more mainstream? Being somebody that's not necessarily from the field, not being a clinical person, but having been involved with inner health now for nearly 2 decades, I've wondered, why isn't this more mainstream? Why don't patients have access to this type of thinking?
Well, the concern, I think, is patients have access now in social media and talking and reading. It's our physicians, it's our professionals that don't have any training. There's, 10 hours of nutrition training to get through medical school. Most residency programs have none. So it's really the educational gap in our medical and professional training.
Do you see some of that changing as we speak, just in the last couple of years? Do you see more training programs coming online to help educate the medical community?
Well, I've seen individual professionals reaching out to get functional medicine training. I don't see the academic institutions embracing this. I think their models are hard to change, and it's psychotherapy and medications, more medicines and maybe more therapy, but a nutritional approach, a metabolic health approach, a functional medicine approach is not integrated into our professional training.
Okay. We're going to hit on a few of those, I think, here in just a little bit, and I call them the third rails of treatment. Maybe a good way to kind of launch into this is to give people a framework for what are we looking at? What is sort of, functional psychiatry 101 here? Give us kind of a framework for what we're looking at, what we're testing for, its importance in your mind.
Well, tonight I'm teaching a course called The Fundamentals for professionals who are expert at their field. They know how to prescribe meds. They know how to make an assessment, but they have no clue about nutritional psychiatry. So to me, the fundamentals of functional psychiatry are looking at a few blood tests, looking at a vitamin D level, The body cannot make the neurotransmitter serotonin without adequate vitamin D. It is epidemic across the globe, low levels of vitamin D. And the research is clear that it affects depression, addiction, and suicide rates. Checking a vitamin B12 level, understanding magnesium and zinc and copper and other micronutrients. So I've distilled the fundamentals into 3 hours of a CME-approved course. And if every psychiatrist knew that material, I'm convinced we could change the trajectory of many individuals with mental health problems. Not all, but many.
I think it's a great point. One of the things I've learned just in working more closely with you as we're together standing this program up within our treatment system, and I am very excited about it because I think it's just going to open up so many great treatment opportunities for our patients and their families. But there's a lot of subtlety in this. One of the things I've learned is, there are a lot of practitioners that call themselves functional doctors. Lots of different types of blood tests that you can do. Maybe just give us a feel for, there's some discretion in here, if you will, or competence, I guess, as to what biomarkers do you want to look at. Because there's a lot of different blood types of tests that you could do, but there's probably certain types of ones over your career, your history of doing this, that you've condensed down to that are very fundamental and important as it relates to psychiatry.
Well, that list is long, so we don't have time. Maybe there's 250 biomarkers. But you're absolutely right. There is some chaos, confusion, and maybe some individual differences that are out there because there's no organized training. So people, their best efforts trying to get the information from a conference or taking a course. Other individuals just reading an article and trying to practice. But I do think my biggest concern has been the reason why I started my educational platform is you can't just translate functional medicine, what you might do to support someone with diabetes or thyroid disease, to someone struggling with addiction and depression. And that's why you've used the term, and I'm trying to focus on the term functional psychiatry, because we can't give up our training as physicians and psychiatrists. We need to understand the family history. We need to understand the neurochemistry. We need to understand the role of medications. Functional psychiatry just becomes a augmentation, another tool in our toolbox to help patients.
Now, I think that's a great point, because I feel like people have a tendency to compartmentalize these things. It's not at the exclusion of traditional Western medicine, psychiatry. They really work hand in glove, do they not?
Absolutely. And when I started the organized training programs, I had many docs who, had to take sides. It's either medicine or supplements. And patients were the ones that lost. To withhold a medicine is tragic. And to withhold a supplement based on an objective test saying that person is deficient also makes no sense. But I think over the last 3 years, the tides have changed. People understand that there's a relationship between diet and health. We now have proven that. Nutritional supplements can be helpful for mental health. And it all can be integrated into traditional psychiatric care.
Let's hit on a couple of the areas that I feel like, and I'd like to know your opinion on this, that provide a little bit of resistance to this becoming more mainstream. I've always felt like some of the big barriers are going to be insurance coverage. Is this something, these types of tests, are they typically or not typically reimbursed via insurance? Is there a lobby or influence around, quote, big pharma and the medications? And I think the other one that's a little more subtle that I do think is important is really just the mainstream physician group that's trained in traditional ways of thinking, being a little bit reluctant to embrace maybe not newer ways, but complementary ways that can help enhance their practice. Do Do you see those as main areas of resistance to adoption?
Yeah, I think you're right. All the above. I think the insurance model is a psychopharm 15-minute med visit just works. And it also works for the pharmaceutical company. In some way, it works for the patients. I only have to take 15 minutes to see this dog. And it certainly works for the doctor because you don't have to think. And the medications become pretty routine. So I think the system is set up to make it easy and financially challenging. And the functional medicine world takes time. One, you have to relearn material. There's a cost. Some of the testing is not covered by insurance. So patients then bear the cost of it. And I think ultimately it just is down to clinicians who want the material. The doctors that I've been working with now over many years are people that care about the outcomes for their patients and understand the medicines have some role but limitations and want the extra training to do a better job.
Yeah, my feel for it is that particularly post-COVID, but I felt like this movement was happening prior to that, is just a higher and higher rise of mental health issues. And since COVID's hit and you've had a lot of were once teenagers, now young adults that are suffering, are these areas that you're talking about, are they suitable for really all populations, good for adolescents, children, adults? It's just this practice works for each of those different individual segments.
Yeah, I think it's most critically needed for our children as more and more kids are struggling. Kids are ending up in hospitals. Kids are cutting themselves, attempting suicide. When I was in training, we were taught a preteen doesn't attempt suicide. And now we see in the news preteen suicide rates have dramatically gone up. So things have changed dramatically. And we can talk about lots of areas. There's no one area, but there's nothing more critical that I think we need to do than integrate a functional medicine model to treating children and adolescents.
Yeah, I couldn't agree more. I could not agree more with that. They're our future, and we need to be able to take care of them. Let's kind of move in a direction of how this modality, if you will, this area of treatment really works in treatment programs. Now, you've instituted this. You oversaw eating disorder programs for many years, and we're practicing this. You see a clear application in mainstream treatment programs, whether it be eating disorder, addiction, residential treatment, which is what we do, or other types of programs like this?
Yeah, most of my career has been in hospital systems that took Medicaid, Medicare, and all insurances. So with the limitations of insurance, we were able to do the objective tests that are not done in any other psychiatric facility, looking at genetic tests to look at genetic vulnerabilities. And as we start doing more and more tests, we understand the reason that individual has been admitted 7 times for relapsing on cocaine or alcohol. The biochemistry is off, and we can see it, and then we can treat it, and then we can prevent this multiple kind of relapsing course of the illness.
Yeah.
So absolutely, a lot of my work was inpatient adolescent psych, adult psych, and then many years in eating disorders, where we're looking at chronically malnourished patients. But those chronically malnourished patients have the highest risk of suicide of any psychiatric illness. Why is that? Well, to me, it's quite obvious. Their brains are starving, and they have no ability to inhibit some of these impulses to kill themselves.
Yeah.
So there's just so much that we can do regardless of insurance and regardless of financial resources.
Yep, that's a good point. Bringing it to us, you and I, we had connected last year and had agreed let's build this component into a residential addiction treatment program. We've always focused real heavily on the psych part, being able to really accurately diagnose whatever the underlying psychiatric issue could be and treat it effectively. Gold standard has always been, as you said, really great medications, appropriate medications, plus therapy equals best outcomes. I feel like the new frontier is really opening up the area of psychiatry and saying, let's get beyond just treating the symptoms, but looking at the root cause. So I'm very intrigued as we move into this and begin implementing this through our treatment programs, how or what you might see and our team might see as it relates to addiction patients.
Well, I've treated addiction patients throughout my career. So running inpatient hospitals, guess who's coming in for whether it's detox or depression or suicide attempt or those with chronic substance abuse issues. And what I found in testing these patients in the hospital and then following them as outpatients, it was just striking to me that our patients with addiction had more biochemical abnormalities, more areas of chronic malnutrition, more genetic vulnerabilities than, let's say, my depressed patients or anxious patients. So,
if you don't mind, why do you think that is?
I think that's life. That's the genetics. But how it translates is what we see. And that's why our current addiction model is so challenging. One, we can help someone stay off alcohol or detox, but the relapse rates remain high no matter what we do, because the biochemistry is such where cravings and all the neurochemistry associated with it is just too powerful. But a functional psychiatry approach can just dampen that to a point where therapy works better, medications work better, all the other clinical tools, including lifestyle changes, just work better. So I was excited when we first started talking because I know patients with addiction are always looking for help and always are just hitting themselves about their sense of failure because they've tried. And biochemically, if we can provide them that lift, I just know it's easier. I've seen it too many times.
Yeah, I think you're right. It in my mind, and correct me where you think I'm wrong here, I look at it as like a foundational element, not necessarily a silver bullet. Lots of different things that InterHealth has integrated over the years. Therapy, being able to deal with trauma, family systems issues, really distorted thinking, how you get in, those four walls of that room and get between somebody's ears and create that relationship to where you move them to make change. I feel like is, we like to say it internally, it's really where the wizards lie. It's a talent, it's a skill. And I look at how we bring in psychiatry as being able to diagnose effectively what's really fueling this fire, what's really fueling the way you feel those symptoms. And this area of functional psychiatry seems to just give us a lot more avenues to treat that more effectively. And then as a byproduct of that, they engage in treatment better because they feel better.
Absolutely. I mean, if you think of many of our patients and who with a history of alcoholism, you just have to take a good family history to understand that they weren't the only ones in their family, right? Their aunts and uncles and relatives. So there's a kind of profound genetic vulnerability there. It is not, bad parenting. And so what is that genetics? It wasn't because mom or dad had a drink at dinner. There's something biochemically going on. And functional psychiatry can reveal some of those mechanisms to just provide some support and a better foundation to utilize other addiction treatment models.
Now, part of the analysis of going through and looking at all of the different unique biomarkers is genetic testing. Just give us a feel for what are you really looking at when you're looking at, quote, genetic testing? What are some of the things that you're really homing in on?
Well, genetic testing now is kind of a hot word in psychiatry, and Harvard Medical now uses the term precision psychiatry to look at lots of genes, although it doesn't translate much to clinical work. It's a lot of research and a lot of theoretical. The genetic tests that we look at provide some basic understanding of how individuals metabolize medications, so what might be the right medicine. We can predict that someone would do poorly on SSRI, which is incredibly helpful because everyone is thrown on SSRIs. So that is helpful. And we also have some markers of individuals who might require higher multi-nutrients. So as we kind of piece apart your individual genetics, we can just make better choices around medicines and nutritional supplements.
Yeah. On the medication side, take SSRIs, for instance. Go see a psychiatrist. They diagnose you with, let's call it the two big ones, major depressive disorder, generalized anxiety. Put you on some form of medication. Does this avenue, this area that we're practicing in now, allow these patients to maybe have an opportunity to lessen off of those medications over time? Is that a potential now that we're able to look at these different biomarkers and institute other types of treatments for them?
Absolutely. Certainly there are some individuals that we're going to find medical and nutritional imbalances that will prevent the need for a medication. Other individuals might use a medication for a period of time. And the challenge in psychiatry now is helping people taper off medications. Because as much as we've tried to say antidepressants were not addictive, we do know there's a significant withdrawal effect for some people. And a lot of my work over the last 5 years is actually using a functional psychiatry model to determine who has problems coming off the antidepressants and a model of tapering people off antidepressants.
So as we sit here and talk and we go through this is, I would say, complicated in the sense that there's a lot of moving parts. There's a time element to this. Now, being in inner health, I've always been a big proponent of residential treatment because I feel like it's a great place for people to get a baseline assessment. They're in a setting where they have access to cutting-edge treatments, but maybe most importantly, in my mind, they have time. And, just over the years, we're a population that wants things done more quickly, faster, get better as quick as we can. But I've never thought there's a substitute for just time, allowing maybe God to do his work and help heal the body with medical interventions and therapies. But time is important. So as it relates to this area of functional psychiatry, I get the feeling people need to know this does take time, because you have to go through the different assessments. The lab results some come back quickly, some come back after a few weeks. Treatments then get implemented and then maybe adjusted, possibly retested. And then over time, you start to feel the benefit of this. Is that accurate in how I've kind of portrayed that?
Sure. I mean, the testing can take some time. As you said, some can come back in a week, some might be 3 weeks. But there are interventions that can happen right away. There are nutritional support supplements that can provide benefit right away. So it is a process, and the challenge is we're all, as you said, looking for that quick fix, be it a drug or a surgical procedure. And time and patience is important. But I think as patients begin to understand what the model is, they can appreciate that someone is looking at them as an individual, and that's not what happens in mental health and addiction. And I think they then can appreciate the time involved. But patients can feel better quickly, and patients can appreciate the difference in a functional model within weeks or months. But certainly I would tell every patient that, we need 3 to 6 months to make significant differences in what has been going on.
That's a great point. So as we were kind of talking yesterday, some of what I was gleaning was there will be treatments. If somebody comes into residential treatment, we have things, interventions, as you say, that we can do on board immediately, almost upon admission or as soon as some of the earlier tests come back. So this area of practice begins as soon as you enter treatment, but then continues on as they go through the course of treatment and go to outpatient.
In some ways, the addiction model is even a little simpler than the psychiatric model, because coming into residential, the substance abuse will be stopped. So there'll be some relief there. And what typically happens is the kind of dysphoric irritability and then maybe the cravings down the road. And what functional psychiatry can do in that kind of 4 to 6 week treatment program is build a foundation to minimize that dysphoric, irritable state that's going to drive the cravings under stress or the next time someone's vulnerable. So as we kind of build that insurance, that foundation to prevent relapse, it just is much easier.
Oh, excellent point. As we go through this and you and I are getting to know each other better, I'm really enjoyed the opportunity to get to know you sincerely. I think sometimes about your body of work, the time you've spent doing it, and how sometimes the market need is so great, but it needs to marry up with timing, market timing, meaning patients, practitioners, the population that needs this, they're ready to receive it. And I'm curious on your opinion. As I follow a lot of thought leaders in this space, and particularly post-COVID, I really think, I don't know if you would agree with this, but there's just been a lot of public distrust of pharma, even maybe major government officials over major research institutions. They've sort of fended for themselves and have found trying to go find the best information from thought leaders and seek the best medical advice they can from those people. And I feel like there's a time right now where our society is wanting this. They're open to it. They realize there are, quote, alternatives to get better other than just the traditional way to do this. So do you feel a little bit of the tailwind in your career right now, that it's sort of moved from a headwind to a little bit of a tailwind as it relates to the market?
Absolutely. There's a growing number of professionals, particularly young professionals and end-of-career professionals, that realize things have to change. But like any healthcare movement in my lifetime, it's the patients and the consumers started pushing the wellness movement, the exercise movement. It didn't come from doctors. Now doctors embrace it and say you should exercise and you should, sleep more. So absolutely, our consumers, people struggling, parents, understand the model is not adequate, and they're driving change. And what's happened is the research community has embraced it. So now we have research around the globe looking at genetics, looking at the gut, looking at nutritional psychiatry. So the research, thankfully, has supported everything I've been trying to say for 30 years. It's just that integration into clinical practice and professional training that's lagging.
I think that's a great point. I was going to hit on some of that with you, which is the research. There is research to support all this area that you're talking about. Do you think, is there research to support it in the addiction category, or is that something that's needed moving forward? The ability to really capture the vignettes, if you will, of the different scenarios, the biomarkers that are being affected, and then the interventions that we put in play. Is that an area that's still needing some research, being addiction?
Yeah, absolutely. I mean, the whole field of nutritional psychiatry needs ongoing clinical research. And, addiction gets pushed aside. Absolutely.
Well, as we kind of conclude this and bring it together, in your mind, where do you see this area manifesting here over the next couple of few years? I know you're working with us, but you also train a lot of these different clinicians around the world and speak on this topic frequently, weekly, I believe. Where do you see this going with this movement we have kind of in our country of people wanting to get healthy again and really shining a light on some of these areas of the market that I think need to be shined on? Where do you see, if you were going to look forward the next 2, 3, 4 years, what do you say?
Well, I'm certainly optimistic, excited, rejuvenated that functional medicine has some life, and functional psychiatry now has a strong foundation, and clinicians want and need this information. Mm-hmm. So I'm certainly optimistic. I think we have to always be cautious that our patients with mental illness can't just take a vitamin pill and be cured. There's many, many factors that are involved, but if we use functional psychiatry as one of those kind of tools, in our toolbox, to repeat myself again, outcomes are just better. Mm-hmm. And kids feel better, parents feel better, and patients' outcomes are better.
Couldn't agree more. I'm optimistic as well. I look forward to working with you into the future and bringing this to life within our treatment programs, and really appreciate all your insights today. I look forward to having you back on as we get downstream, and we'll roll some of this around with our chief medical officer and probably deep dive into a few of our different case studies. But I appreciate you being here today.
Great. Thanks for inviting me.